This week, we're covering Novo Nordisk's new high-dose Wegovy trials, Eli Lilly plans for lower Zepbound pricing, and Medicare's upcoming GLP-1 price negotiations. Plus, hear about a breakthrough weight loss procedure and an exciting new medication showing record results. And don't miss the big announcement about an unforgettable GLP-1-focused cruise adventure.
Cruise adventure?
That's right.
Welcome to the Downsized News. It's Monday, January 20th, and we're excited to share the latest on GLP-1 medications. I'm Lorraine Durham, and I've lost over 50 pounds using tirzepatide. That's what's in Zepbound and Mounjaro.
And I'm Christopher Durham, and I've lost 94 pounds with the help of these medications. Today, we're here to chat about everything you need to know about GLP-1s, Mounjaro, Zepbound, Wegovy, Ozempic, tirzepatide, Semaglutide, and a few more we're going to talk about today.
Ooh. Before we start, just a quick reminder, we're not doctors. We're passionate about GLP-1s and weight loss, but talking to a qualified healthcare professional is important before starting any medication or treatment.
And of course, make sure you join us for the Downsized Live this week. It'll be on a special day, Thursday at 7 p.m. Eastern Standard Time.
Thursday, that's right. Thursday.
And while you're here, don't forget to like, subscribe, and hit that notification bell so you never miss an update.
Now let's get into today's news and explore what's happening in the world of GLP-1s. In story number one, Eli Lilly shared some big news this week about its 2024 sales. The company expects to bring in around $45 billion for the year. Wow, that's a huge number, but it's $400 million less than they predicted just a few months ago. For the fourth quarter, Lilly expects $13.5 billion in revenue. This total includes about $3.5 billion from Mounjaro and $1.9 billion from Zepbound. Wall Street had higher hopes, expecting $13.94 billion for the quarter and $45.49 billion for the year. The slowdown seems to come from GLP-1s Mounjaro and Zepbound. These drugs are still growing in popularity, but not as fast as Lilly thought they would. CEO David Ricks said the U.S. market for incretin meds grew 45% compared to last year. Wow, that's a lot of growth. But Lilly had expected even faster growth. Ricks pointed to a few reasons for the slower growth. One is changes in Medicare rules. These changes may have stopped some patients from refilling prescriptions in December to save on costs in the new year. He also said the obesity market is still very new and the company is learning as they go.
You know what that translates into?
They can't make enough.
They were out of stock. That's exactly what it translates into.
We used to say in retail, you can't sell it from the stock
We're
room,
learning as we go.
You can't sell it if you don't got it. Investors didn't take the news well. Lilly's stock dropped by about 6.5% after the announcement. This isn't the first time this has happened. Back in October, when Mounjaro and Zepbound missed third quarter sales expectations, Lilly's stock fell 8%. Ricks explained that predicting sales in the obesity market is tricky. He said the company is good at forecasting other drugs, but GLP-1s are a different story. Still, he sees a lot of ways the market can grow. One big opportunity is new uses for GLP-1s. Last month, Zepbound was approved to treat sleep apnea. Rick said more approvals like this could give patients better access to the meds. Another growth area is outside the U.S., where the company has barely launched these drugs. Looking ahead, Lilly said it expects sales of $58 billion to $61 billion in 2025. New drugs for cancer, Alzheimer's, and other conditions will help drive this growth. Ricks reminded investors that Lilly is more than just diabetes and obesity drugs. Even without GLP-1s, he said, the company would still be one of the fastest growing in the industry.
He's doing damage control.
I mean, he wants to keep his job, I guess. You don't make your sales projections, no matter how huge in billions with a B they are. You know, you gotta report to Wall Street.
And not to
to Wall Street.
Not to defend Ricks here, but they're wildly profitable.
Wildly.
I mean, I don't know. Wildly isn't even a big enough word to say how profitable they are.
I mean, they missed it by $400 million, which sounds like a lot, but in the terms of a $45 billion market, that's
growing at 45%.
It's not
45%. It's insane. It's insane. Well, so in the second half of that story, CEO David Ricks set out to do damage control through a series of TV interviews and a keynote at the JP Morgan Healthcare Conference this past week. He focused on the company's bright future with new drugs and the growing success of Zepbound. So he hopped all around TV going, hey, we're okay, love us.
I mean, we've seen him on speaking.
Yeah, he's been all over the place.
Well-spoken guy. He's got it together.
Yep.
Good for him.
So one of Lilly's strategies involves expanding the vial options for Zepbound. Now, Ricks is he told Kramer this, he told MSNBC this. So he said, we'd like to lower the entry cost and have more doses available. He's speaking about the vial costs. He said, hinting at plans to make the drug more accessible. Now, he didn't give a lot of detail on it. So is that just Lilly Direct? Does that go to your neighborhood pharmacy? We have no idea. Mm-hmm. But certainly if they could fulfill more prescriptions, they would have an easier time of making their numbers.
More sales equals more profits.
It doesn't take an economist to say that.
Right.
Last year, Lilly introduced Zepbound in vials as a lower-cost alternative to injectable pens. The move aimed to help patients who pay out of pocket, also known as self-pay. Currently, around 1 in 3 or 1 in 4 Zepbound users fall into this category, a group calls a meaningful segment. Now, we know the lower-cost thing is a bit of a misnomer because it's graduated pricing. It gets more expensive the higher it gets.
Yeah.
So if you did the math per milligram of medication, you'd still be almost at $1,500 for a 1 month at 15 milligrams.
Right.
So it's not really any cheaper.
The 2.5 milligram vial is a good deal. The 5 milligram vial is just about what it costs with the coupon.
Yeah. So at the same time, Lilly is ramping up production of its incretin drugs like Zepbound. We know they're building a factory not far from where we live. It's actually in Concord, North Carolina. Ricks noted that the company plans to produce at least 60% more doses in the first half of this year compared to the same period in 2024. He added that tons of supply are coming online as the company increases its manufacturing capacity.
Tons of supply.
Tons of supply. Well, I mean, he's a very personable guy, so he's doing these interviews kind of
lots of medication in it.
He's out there on the road going, Eli Lilly is great, please don't ditch our stock.
I'm doing a tap dance. Mm-hmm.
Still, some critics noted, of course, that vials were only offered in the lowest doses, as we did as well, and the prices $3.99 or $5.49 a month remain high for many. The expansion of vial options could address those concerns while helping Lilly compete against compounding pharmacies that produce cheaper alternatives. Ricks also highlighted the potential of Lilly's next-generation obesity treatments. The company's experimental weight loss pill, orforglipron, is expected to be a game-changer. The pill, which could be approved as early as next year, offers a simpler, more convenient option for patients. In clinical trials, orforglipron has shown impressive results, helping patients lose up to 14.7% of their weight compared to 2.3% of the placebo. Lilly plans to release more late-stage trial data this year, fueling optimism about the drug's market potential. While competition in the weight loss drug market is heating up, particularly with Novo Nordisk's Wegovy, Lilly is betting on Zepbound's growing demand and the promise of orforglipron to solidify its leadership position. By focusing on innovation and expanding access, Lilly is positioning or hoping to position itself for strong growth, even as it works to rebound from its recent earnings miss. And as there's, 600 drugs in development that are all coming for its share.
I mean, why not? Billions are on the line here for the first people who can come to market with a decently priced GLP-1 drug that works. And a pill? Wow. Yeah.
Well, and if they're going to release in vials, that could begin to explain the secret NDA information that they didn't want the FDA to share. That's a market changer.
In story number 2, big news for anyone using Ozempic, Rybelsus, or Wegovy. Medicare is stepping in to negotiate the price of Semaglutide, the active ingredient in all 3 of those drugs. As we reported earlier last week, this decision comes as part of the second round of drug price talks under the Inflation Reduction Act. Medicare will treat all versions of semaglutide, whether it's used for diabetes or obesity, or whether it comes in a pill or an injection, as a single product during negotiations. Since Ozempic has been on the market since 2017, semaglutide qualifies for these negotiations starting in 2025. On the other hand, newer drugs like Eli Lilly's Mounjaro and Zepbound won't be up for negotiation until 2030 because they were approved more recently. Currently, Medicare covers semaglutide for diabetes treatment, but not for weight loss. That might change soon. Wegovy, which is approved to lower heart risks for people with obesity or who are overweight and have heart disease, could be already covered under Part D plans. These negotiations have the potential to impact the entire GLP-1 market. Lower prices on Ozempic and Wegovy could force Eli Lilly to adjust their pricing on Zepbound and Mounjaro to remain competitive. For patients, this could mean more affordable access to a wider range of GLP medications. When negotiations are complete, Medicare will set a maximum fair price for semaglutide. This single price will apply across all forms of the drug, whether it's Ozempic, Rybelsus, or Wegovy. Prices for the different doses, formulations, and packaging will be adjusted to match that negotiated rate. However, it remains to be seen how the incoming Trump administration will handle this process. With a change in leadership on the horizon, policies surrounding Medicare's drug price negotiations could shift, potentially impacting how these plans unfold. For those relying on GLP-1 medications, this is a major development to watch closely, as it could reshape the market, making these life-changing treatments more accessible or introducing new uncertainties in the near future.
We encourage everyone to reach out to your congressman, your senator, say, hey, we need this help, and make sure that the new administration pays attention to this and lets this negotiation go forward. Story number 3, Novo Nordisk also shared big news. So it's Eli Lilly, Novo Nordisk. We're on a run with the big guys. So they shared big news about Wegovy and its weight loss drug. A higher dose of Wegovy helped people lose more weight than the current approved dose in a new study. The study looked at people with obesity but not diabetes. Some took 7.2 milligrams of Wegovy, others took the standard 2.4 milligram dose, and a third group got a placebo. Over 72 weeks, people on the 7.2 milligram dose lost 18.7% of their body weight. That's more than the 15.6% weight loss seen with the 2.4 milligram dose. 1/3 of people on the higher dose lost at least 25% of their body weight.
Wow.
So it's performing right there on par. I mean, it is right there.
Yeah, they just needed to get to a higher dose.
These results are good news for people on Wegovy. Novo says the higher dose could make the drug more effective, but Wegovy still trails Zepbound, Eli Lilly's competing GLP-1 drug. In a similar study, Zepbound showed a 20.2% weight loss. Novo's executive team had high hopes for the 7.2 milligram dose. They predicted it could lead to 20% weight loss while still being safe. The company says the higher dose is well tolerated with mild to moderate side effects. Most side effects were typical of GLP-1 drugs and went away over time. Novo plans to share more detailed results at a medical conference later this year. This will give a better look at the safety and side effects of the higher dose. Novo also hinted that the new data might help its other drugs, like CagriSema, a combination therapy. So, of course, CagriSema has semaglutide in it. So if they could increase the dose, it could be impressive. For now, Novo sees the 7.2 milligram dose as a step forward, but the race between Wegovy and Zepbound is far from over. So what do you think? 7.2? I mean, that's more than 2 times the highest dose right now.
I wonder if the side effects went up with that higher dose in that group.
They say it's well tolerated. I find that hard to believe. We see a lot of side effect issues.
Everyone says nausea with semaglutide, so I'd be interested how that worked to go from 2.4 to 7.2. That's a big jump.
Well, they're not really telling you that you jump. There might be some intermediary doses. I think that's just what they tested.
Oh, they got up to 7.2?
They're not giving us enough detail to know that is the problem.
Well, I know Eli Lilly tested, 20 milligram
I think
doses?
so. I think 20 and 25.
And I think we know that those incremental jumps have to be substantial at those higher doses.
Yeah, it's got to be a good size. It's got to be a good percentage. It can't just be small.
A little bit. Mm-hmm. In story number 4, the understanding of weight maintenance is still evolving. Don't I know it? But an innovative option from WVU Medicine could offer doctors and patients a new tool to build long-term care plans for the disease of obesity. Losing weight with GLP-1 medications like Zepbound, Mounjaro, and tirzepatide has changed lives. These medications help people achieve significant weight loss. but stopping them often leads to weight regain. WVU Medicine is working on a solution. Their team is testing a new outpatient procedure called duodenal mucosal resurfacing, or DMR. This procedure could help patients maintain weight loss even after stopping GLP-1s. Dr. Shailendra Singh, who leads the WVU team, says they are excited about the study. It's called Remain-1. Patients first use tirzepatide to lose at least 15% of their body weight. Then they undergo either the DMR procedure or a placebo procedure. DMR is done with an endoscope and targets the duodenum, the first part of the small intestine. This area plays a key role in obesity and metabolism. The first patient in the study had great results. 4 weeks after the procedure, the patient kept off the 15% weight loss achieved with tirzepatide. This is a big deal since many people regain weight quickly after stopping GLP-1s. Dr. Singh says obesity is a complex condition. He believes DMR could redefine how we think about long-term weight maintenance. The WVU team has a history of leading research in obesity treatments. They are also involved in other studies like using DMR for diabetes care. These efforts show their commitment to finding innovative solutions for patients. The Remain-1 study is sponsored by Fractal Health, the company behind the DMR technology. WVU Medicine is giving hope to people fighting the disease of obesity.
WVU is West Virginia University, first of all.
Right. So they're going to stick a scope,
an endoscope, right?
Down your throat.
Might be the other way,
Or the
but
other
yeah.
way.
I'm not sure which.
A colonoscopy is that way, and the endoscopy is
well, it's getting to the duodenum, so it's getting.
Yeah. So I think they must go through your throat, through your stomach, to your. And what do they do to it when they get there?
They're resurfacing it somehow. I don't really understand.
That sounds terrifying.
I'm sure it would be like your colonoscopy, and you would be sedated, and you would have no idea what's happening. So it would be.
And is that a
non-event of a procedure?
Yeah, and they think that would help keep your weight off permanently?
That is what they seem to believe.
And I need more information about this.
That's all that was in the.
Yeah.
It was also a press release, and I just thought it was fascinating because we have these ongoing conversations about GLP-1s, and we've talked to a lot of people who have had various forms of bariatric surgery.
Right.
Well, this isn't really either one of those, but all of the good obesity specialists that we've talked to have talked about using all of the options and creating a continuum of care that was personalized to the individual patient. So maybe something like this could be just another piece of that puzzle to make it work for more people. I don't know. It's cool, though.
Definitely do like a cost analysis, like, being on the medication for the rest of your life versus
it's an outpatient procedure, though.
Maybe they could just make your body work better.
Yeah, I don't know. What I love is there's research in it, and people are trying to come up with complementary things. So they're not saying do this instead of GLP-1s. They're saying
it's a maintenance. It's a maintenance solution once you've lost the weight. So
I'm fascinated. Sign us up. Well, I'll go try it.
I'm not ready to sign up
it.
yet. Just yet. I need to know more about it.
I will volunteer.
Sounds interesting.
Absolutely. All right. Story number 5 from Hangry Pharmaceuticals and Kylera Therapeutics just shared big news. Their new GLP-1 GIP medication, HRS 9531, showed impressive weight loss results in a phase 2 trial. Patients lost an average of 22.8% of their body weight over 36 weeks. That's a huge deal. The trial took place in China and included 61 people, so it's a trial. Of those, 49 received the medication, which was given once a week as an injection. The dose started small and increased over 24 weeks to 8 milligrams, which was then maintained for another 12 weeks. The results were clear. Patients on HRS 9531 lost a significant amount of weight compared to those on a placebo. Even better, there was no sign that the weight loss had plateaued by the end of the study. About 59% of the patients lost 20% or more of their body weight. HRS 9531 is now looking like it could be the best in class for injectable obesity treatments. It outperformed Eli Lilly's retatrutide, which showed around 21% weight loss. Safety was also a focus. Most side effects were mild and similar to what's been seen with other medications in this class. Most of the issues, like stomach discomfort, happened when patients were adjusting to the medication. Ron Renaud, CEO of Kylera, called the results compelling and said the company is ready to push forward with global phase 3 trials. They believe this medication has the potential to make a big difference for people struggling with obesity. HRS 9531 has already shown promise in early studies, and Hangry is also testing other forms of the medication, including an oral version. They're looking at how it could help people with both obesity and type 2 diabetes. This is exciting news for patients who are using GLP-1s to treat the disease of obesity. A new option could soon be on the horizon, and it's showing some of the best results we've seen so far. So it's a GLP-1, GIP, sounds a lot like something else we know. The Zepbounds, the Mounjaros of the world, and performs a little bit better. I wish I understood enough about what the differences are between these medications and how, you can patent various GLP-1s in there, because we only get it's a GLP-1. We don't know what makes this GLP-1 in Semaglutide different than this GLP-1 in Zepbound, right? They both have
different?
I don't know.
A GLP-1 was a GLP-1.
Well, there must be a difference.
Like an apple is an apple.
Because this one has a GLP-1 and a GIP.
Well, GIP
is what's the other half.
It's different,
of
right?
Zepbound,
That's different. Those are definitely two different things.
So what's the difference between this and Zepbound?
I don't know. I mean, it's a small study, but it looks promising. And this study was done in China. Are there obese people in China?
Of course there are.
I mean, they have billions
We've
of
done
people.
a couple of stories on some of these medications being approved for China. So
yeah, interesting.
Yeah.
In story number 6, Noom has announced updates to its GLP-1 Companion App, introducing new features aimed at supporting users taking GLP-1 medications for weight loss. The updates include medication tracking, meal planning, and AI-driven calorie goals. These tools are designed to improve medication adherence, manage side effects, and enhance weight loss outcomes. According to Noom, the app combines medication support with tools to encourage healthier habits. Features like the Welly Meal Planner offers personalized meal suggestions, while dynamic calorie goals adjust targets based on activity levels and body scans. Noom states that these updates aim to address common challenges such as maintaining lean muscle mass and sticking to treatment plans. Data provided by Noom shows high engagement with the app. In the first month, 95% of users adhered to their medication schedules, and many utilized features like meal logging and side effect tracking. The updates align with the FDA's draft guidance on prescription drug use-related software, or PDURS, which could pave the way for software to be included as part of medication labels. Noom has positioned its app to fit within this framework, offering a companion product that supports dietary and activity goals as outlined in medication guidelines.
So you're target number one for something like this. Is this something you would do?
You can do the same thing or a similar thing with ChatGPT. You can go to ChatGPT and say,
yeah, but this is all integrated into one app. You're not having to go ask it to do 10 things.
I mean, yeah, it sounds interesting. And as we have been talking with our viewers about meal logging and calorie tracking and meal planning, I mean, it sounds like it can do a lot of that in one place. So,
and they just added that to this. So I think, because I've watched the Noom guy talk about this a good bit, one of the challenges of these medications is a lot of people are being written these prescriptions and then kind of just being left on their own. Either their local doctor doesn't really know how to help them because they're not experienced in them, or they're getting it from someone, a telehealth provider that doesn't have those services. So I think what Noom is trying to do is create this system of support. And to me, it's a great idea. Now, I haven't used this product, so I couldn't tell you whether it is a great idea.
I mean, I tried Noom back years ago before GLP-1s, and it kind of gamifies the whole weight loss. And so I think anything that can make you more interested to come back to it and put some more information in and keep going and keep doing all the things can definitely make you more aware of what you're doing. And if it's helpful, if it's giving people good tips and good guidance, then I wonder how much it costs.
noom, reach out to us. I would love to test it out for you. We're happy to give you our thoughts on it. I mean,
sure.
this is definitely something. Our community is clamoring for more help with these medications.
Yeah, we definitely need a framework for help.
Protein guidelines and tracking, side effect tracking. I mean, there's so many things. And then if it could also integrate with my scale or my continuous glucose monitor or my Apple Watch or whatever, you had a whole picture, a dashboard for...
Well, to me, the less things I have to directly input, the better I like it.
Right.
That's why I like my Apple Watch. I don't have to think about it. It's just there. The app on my phone for my scale, I don't have to then log my weight into a journal. It's just there. I like those tools that just work like that.
Yeah, I mean,
I don't like to write.
If I had a dashboard
Pencil and
for
paper.
treating my disease and I could go to it and look, and then it could take that data and say, oh, maybe you should adjust your eating, or we recommend, whatever it is.
You didn't hit your steps today.
Right.
Maybe
Whatever
you need
it is.
more movement in your day.
It could be a compelling. Anyway, noom, reach out. We'd love to talk to you. Story number 7. We've talked about it before. We'll keep talking about it. Big news, we're launching our first ever Downsized at Sea cruise. Join us for a 4-night GLP-1 adventure from July 23rd through the 27th, 2025 aboard the Celebrity Reflection. Departing from Fort Lauderdale, we'll explore the stunning islands of Bimini and Nassau, Bahamas. Connect, learn, and have fun with exclusive Q&A sessions, panels, group activities, and more. Plus, every guest gets a cool Downsized swag bag full of surprises. Prices start at just $899 per person, double occupancy, some restrictions apply. Spots are limited. Please book now on thedownsized.org. I'll put a link in the bio as well. Let's make this an unforgettable adventure together. So come hang out with us on a cruise ship, exercise with Lorraine. We'll have a great time.
Yeah, we're really looking forward to it. They're going to seat us all together at dinner, so that'll be nice. We'll have that to touch base every night. And yeah, really looking forward to it.
Well, that wraps up today's edition of the Downsized News. We hope you found the updates helpful and insightful as you navigate your own GLP-1 adventure.
And while you're here, don't forget to check out our Downsized store at thedownsized.org, where you'll find GLP-1 companion products and more to support your adventure. We're an Amazon affiliate, so thank you. We earn a small commission on each purchase.
And we added a Downsized bookstore portion of it. So Alexandra Soa, Lorraine.
Dr. Alexandra Soa, yes. Her book, Ozempic Revolution, is on our bookstore. You can check out my interview with her we did this week. I also just started following her on Instagram. I suggest everyone do that too. She's fascinating. She's got a lot of great information. And actually, her book, The Ozempic Revolution, outlines a kind of a framework for people looking for some GLP-1 support. So check that out.
Dave Knapp's book's available there, and there's a couple of other books there that are all focused on helping you with your GLP-1 journey. Before we sign off, if you've enjoyed following the adventure Lorraine and I are on and want to stay updated with real stories, insights, and tips about GLP-1s, please like this video and subscribe to our channel. Be sure to hit the notification bell so you never miss our latest updates and live streams. And of course, a special thank you to our Club Downsized members. Your support means the world to us and allows us to keep creating content that inspires and informs. We could not do this without you.
Your support helps us grow and continue sharing valuable content for those of us navigating life with this disease of obesity. I'm Lorraine Durham.
And I'm Christopher Durham. And we are the Downsized. See you next time.